Here's Dr. Mark Thompson from Paragon Chiropractic, your home for fast, effective pain relief, with another essential health tip.
Next, we're going to work on lower cross syndrome. So it's exactly the same thing as upper cross, but we look at you from the side. We're going to have some really tight muscles and weak muscles that alter posture. So it's either going to accentuate the low back curve or it's going to flatten it. And you're going to almost have your tail tucked between your legs. Either way, it puts more stress on the low back. We don't want that, okay? So there's a couple of things that you want to do. A previous video talked about the bed stretch or the figure 4, because we want to make sure we're getting the posterior hip, okay? Then we want to get the hip flexors. So that's going to be the up dog video or potentially the donkey kick, where I'm standing on one leg, kicking back, stretching that hip flexor. So now what we're going to do with the LaCrosse ball is actually right here. Here's the top, my hip crest is here. And almost in this front pocket, there's a muscle about as big as your hand on the front of the hip. And usually right in the bend of the hip and maybe just a little below or a little above, usually about ½ an inch to an inch, we're going to put the ball. And so this is a little more awkward because as we lean against the wall or the door, it's like a 45. You don't want to be coming at it straight from the side or straight from the front. It's really kind of an oblique angle. So I'm going to lean up here. I'm going to bend this knee and I'm going to press with this leg, and I'm right on a good point. You'll know, again, because it's going to be very tender. It's going to be very sharp, and we're going to hang out until the sharpness starts to dissipate. It's usually about 15 or 20 seconds. So then I'm going to roll up or roll down and get the second point. So right now we're working on a muscle called the tensor fasciae lata right here in the front part of the hip. So then we have the IT band that basically follows the seam of your pants all the way down to the knee. So this muscle on the front of the IT band and attached to it, when it's tight, it wants to kind of pull that whole IT band forward, and that could lead to knee problems. So the muscle on the back of the IT band, usually the gluteus minimus, is going to be activated, and so we're going to do that next. So we've already done the tensor fasciae lata, the 2 points on the front. Now we're going to roll back just a little bit, and it's usually right under the hip crest, kind of where your belt rides. So the first place is going to be there, again, kind of a 45-degree angle. I'm going to lean against it, roll around until I get right on the point, and then I'm going to hang out there, okay? Then the second point is usually further down, because the first one is about here. The second one is a little closer to the top of the femur, and I'm going to roll down, and same thing. I'm going to find that spot and hang out there. So that is the LaCrosse ball for the lower cross syndrome. So make health a habit.